Hello, I'm reaching out to you today to discuss the COVID-19 pandemic. More specifically, what we have done and what we're working on here at Ridgeview to both slow the spread of the virus and treat those who may be infected. First, I hope you and your loved ones are well. These are uncharted waters that we're navigating through right now, both locally and globally. So I want you to know that I and the entire leadership team here at Ridgeview understand the fear and anxiety that many are feeling right now. But my message to you is simple. We will get through this, and we will get through it together, not just as a community provider of healthcare, but as a community. In fact, it's my firm belief that in the end, we will come out on the other side stronger, more united, and in a better position to handle any challenge that may come at us in the future. As you know, this is an extremely fast-moving situation with state and federal guidance changing daily, sometimes hourly. But let me assure you, we will do our very best to keep you up to date with what we know and what we're planning to do in the future. With that being said, let me share with you just a few of the many things we have done here to prepare the COVID-19 pandemic. We have our Hospital Emergency Operations Center open and are meeting daily, many times a day in fact sometimes, including weekends, to monitor and act on Minnesota Department of Health and CDC guidelines and advice for COVID-19. We're also meeting with other health systems and sharing protocols and models for caring for patients and for staff. As for screening for COVID-19, Ridgeview has screened many patients in several locations based on patient presentation and MDH testing criteria. But at this point, we are only screening those that meet specific criteria and allowing for some physician discretion. At the time of this taping, Friday, March 20th, Ridgeview has no confirmed COVID-19 patients in any of our 3 hospitals. But we do expect that to change, and we are ready for it. Finally, we are adapting our Ridgeview eCare to also serve as a free online screening tool for COVID-19. This tool will walk patients through a questionnaire to help them and Ridgeview providers determine what the next steps in their care should be. This tool is important because it will help us to identify and prepare for more serious cases before they come in, as well as manage lower risk patients at home, reducing the risk of them spreading the virus if they were to come to the hospital. We have dealt with infectious diseases before, but this one, due to its unknown nature, has many people in a panic. This is not the time to panic. It is a time to act. Here's what we can do to help contain the spread of COVID-19. First, take social distancing seriously and ask your friends and family to do the same. We are all in this together, so please stay 6 feet away from others and avoid groups larger than 10. Second, of course, everyone needs to wash their hands frequently and make sure they wash them well. That means at least 20 seconds with soap and warm water, or if that's not feasible, use hand sanitizer with at least 60% alcohol. Third, regularly wipe down commonly touched surfaces like doorknobs. And most important, if you don't feel well, please don't leave your house. Call your doctor or use Ridgeview's eCare tool to help direct your next steps. Well, it appears we have a big challenge ahead of us. Know this, our highest priority is to help ensure our patients, our teams, our families, and our communities get through this unprecedented time as safely as possible. We are prepared, we are strong, and we are Ridgeview.